Bismillahirrahmanirrahim. Quote of the day is convey from me, even if it is only a verse. This is the quote by Prophet Muhammad sallallahu alaihi wasallam. Today, the topic is health education. My name is Dr. Aamna Khalid. I'm PGR Community Medicine, and I will be presenting this topic under the kind supervision of my supervisor, Professor Dr. Saira Afsar, who is Dean Institute of Public Health. Learning objectives for today's presentation are the functions of health communication, approaches to health education, stages of health education, models of behavior change, communication models, different methods of behavior change, and group approach methods. Then we will do the practice of MCQs. First of all, we will see what is health education. Health education is the process of providing information, knowledge, and learning experiences to individuals and communities in order to improve their health and encourage positive health behaviors. Objectives of health education are to produce positive behavior change, to improve health of individuals and communities, to increase awareness about the health issues, to enable people to control the health determinants. Health determinants are the environment, the social conditions, and the lifestyle which are under the control of people. So functions of health communication are information, means sharing the health facts with people, education, teaching them healthy behaviors, motivation, encouraging them for healthy actions, persuasion, changing their attitudes. Then counseling means providing the guidance, raising morale, boosting their confidence. Health development means promoting the growth and organization, that is coordinating efforts. There are four approaches to health education: service approach, regulatory approach, health education approach, and the primary healthcare approach. A service approach is basically that health services are developed and provided. For example, the vaccination programs, and these services may be provided at the doorsteps of the people. Then the second one is regulatory approach, where there are government laws and regulations which are implemented. For example, there is ban on the smoking, so people should refrain from smoking. Health education approach, and that health messages are delivered through media channels. For example, the road safety campaigns. Then fourth one is primary healthcare approach, where the focus is on the community participation. For example, the sanitation programs, and they become successful when the community itself participate in the program. Then there are six stages of health education, starting from a stage of sensitization to publicity, then education, then attitude change, then motivation and action, and then at the end, the stage of community transformation. The stage of sensitization is the first stage where people become aware of a health problem and the messages highlight the seriousness of the issues. For example, AIDS awareness campaigns, polio awareness messages will be conveyed to the people that how much dangerous is AIDS for them or polio for them, for their children. Then comes the stage of publicity, where media and advertisements are used to inform the public about diseases and their consequences. Different media channels can be used, for example, television, newspapers, posters, announcements, and so many others. Social media, especially these days. Then comes the stage of education, where the actual health education is delivered through community leaders who convince people to adopt the healthy practices. The community leaders can be the imams of different masajids, the school teachers, community elders. The goal at this stage is to convince people to understand the health issues and adopt the healthy practices. At this stage, we approach basically those people uh, uh, who are still not sensitized to the issue and they are still practicing the same things. Then comes the stage of attitude change, where people begin changing their attitudes toward the healthy behaviors. The healthy practices become socially accepted, and the community starts to view certain behaviors differently. For example, reduced smoking in the public spaces. Uh, People now view it as socially unacceptable. Then comes the stage of motivation and action, where people are motivated to take concrete action. The health educator plays a key role in encouraging the behavioral change. For example, joining the nutrition counseling programs, attending smoking cessation programs, taking up regular exercise routines. Now they are doing it themselves, being motivated. Then comes the stage of community transformation, where the entire community adopts the healthy behaviors and the social norms change permanently. Government laws may support the behavior change. For example, a case study from Singapore is that the laws against chewing gum and public smoking led to nationwide transformation in the behavior. Then we have the Shannon Weaver communication model. This is a two-way process of information exchange. It starts from the sender who encodes the message, and then comes the message, which is actually the content which has to be conveyed. Then comes the channel that which media is used to convey that message. Then on the fourth number, we have the receiver who decodes the message, who whatever he has received, and then comes the feedback, which is a very crucial stage that which confirms that the understanding of the receiver. Feedback actually flows back from receiver to sender, confirming whether the message was understood or not. So this is again the repetition of same thing. Then comes the qualities of a good sender. The message should be clear. These are the actually five C's. The message should be clear. He delivers the unambiguous message. The person should be confident, who speaks with assurance and authority. He should be credible, a trusted and knowledgeable source. He should be conceptually clear, who himself understands the topic thoroughly. The message itself should be concise, communicates efficiently without any excess. Then we have different communication channels like print media, which includes pamphlets, posters, newsletters. Then the audio-visual media like films, videos, presentations. Then the verbal communication like lectures, discussions, talks, and a mass media including television, radio, online platforms, including today's social media channels. Uh, then developing a health education message. The message should be developed based on these five things: that it should be simple, which should be easy for everyone to understand. It should be clear, means there should be no ambiguity or confusion for anyone. Then it should be concise, means brief and to the point, focused. It addresses one issue at a time, and solution oriented, means it provides the practical steps or answers to the people. These are the key components of a health message. Data means the health educator present or in his message present the facts and the statistics. For example, he states that 30% of the children are undernourished. Then comes the warrant, explain consequences of the unhealthy behaviors. For example, he states that smoking can cause lung cancer. Then comes the claim that he suggests action to solve the problem. For example, he suggests people that they should join smoking cessation programs. Then once a behavior has been changed, there are different methods to maintain that behavior. And these are the support groups. That groups provide peer encouragement and shared experiences. For example, we make a diabetes support group. Then comes the positive reinforcement. Positive reinforcement rewards and incentives encourage healthy behaviors. So, for example, we give incentives for the healthy habits to people for having adopted a positive change. Negative reinforcement penalties discourage the harmful behaviors. For example, fines can be placed for the public smoking. Then mm, health education can be done using different approaches. Like we can have a mass approach and a group approach and then individual approach. If we have adopted the group approach, then we have these eight different methods for the group approach. The chalk and talk means the lecture method. Demonstration means people learn by doing or by saying the things. Then group discussion, panel discussion, symposium, workshops, role playing, conferences, and seminars. So in group discussion, usually 6 to 12 members are the participants, and there is face-to-face interaction in a circle or around a table. And the goal is to encourage sharing and exploring of the ideas. But the limitation of this approach is it may result in the unequal participation. The dominating people may speak more, and the others may speak less and participate less, like this. Then comes the panel discussion. 4 to 8 experts discuss a specific topic, moderated by a chairperson. There are no fixed speeches. It's actually open and flowing discussion. It's moderated by a chairperson to keep the discussion on track, and the audience members may ask the questions at the end. Then comes the symposium, which is a series of formal speeches on a selected subject, and the different experts present various aspects of the topic. There is limited open discussion, but it has a structured format, and it's common in the academic and professional settings. Workshops where small groups work collaboratively on a specific problem. Participants develop concrete action plans. It's highly interactive and hands-on learning, and the participants develop skills through practice. Role playing, when we can use the role play when situations cannot easily be explained in words alone, and the purpose is to demonstrate the human relationships, behaviors, and social dynamics. And it encourages the active participation from all the members, and the learners gain empathy and practical understanding. Then at the end, we have conferences and seminars where a large audience, specifically regional or the national scale, it focuses on a specific topic or theme. Uh, this is a broad level discussion across many perspectives. It uses various learning aids and media. Formal presentations are given from multiple speakers. And then we have two important models of behavior change. One is the health consciousness model, which has seven steps, and the AITA model, which has 5 steps. First, we will see the health consciousness model. There is stage progress from awareness to the full social change, starting from the health consciousness, the knowledge, self-awareness, attitude change, decision making, behavior change, and then the social change. So stage one of the is the health consciousness, where people in the community begun hearing messages about smoking dangers. I have taken the example of smoking here. So if, for example, posters, TV advertisements, and warning labels on the cigarette packs make people aware that smoking is harmful. The results of this stage are that people start thinking that smoking might be dangerous. Then second stage is the knowledge, where people receive detailed information about the smoking hazards. For example, the doctors explain that smoking causes lung cancer, heart disease, and stroke. Health campaigns explain how smoking damages the lungs. The result of this stage is that people start understanding why smoking is harmful. Then comes the stage of self-awareness, where a smoker begins reflecting on their own behavior. For example, he thinks that I smoke 10 cigarettes a day and my cough may be due to smoking. So the result of this stage is the individual recognizes that their own health is at risk. Fourth stage is attitude change, where the person starts changing their attitude towards smoking. Previously, uh, he thought that smoking helps me relax, but now he thinks smoking is damaging my health. So the result is smoking is no longer viewed positively by the individual. Fifth stage is decision making, where the person makes a conscious decision to act on their changed attitude. The person now decides, I should stop smoking. They consider joining a cessation program or reducing the cigarette intake. The result is a firm intent to change behavior is now formed. Sixth stage is behavior change, where the person actually stops smoking and replaces old habits. For example, the person avoids cigarettes, uses nicotine replacement therapy, and attends counseling sessions. The result is a new, healthier behavioral pattern that has been established. Then comes the last stage, which is social change, where individual behavior change spreads across the wider community. For example, more people quit smoking and smoking becomes socially unacceptable. Public places introduce smoking bans. The result is the whole community adopts healthier behavior. Lasting social change occurs now. Then comes the second model, which is the ITA model, awareness, where interest, evaluation, trial, and adoption. We'll discuss each one in detail. The first stage is awareness, where people first hear about the health risk of smoking. For example, TV advertisements about lung cancer and warning labels on cigarette packs spread the message widely. This stage is similar to the first stage of the health consciousness model, where first stage was health consciousness. So the result again is the same, that people become aware that smoking is harmful. Then the second stage is interest, that a smoker becomes curious and wants to learn more about quitting. That the person reads articles about smoking hazards and attends a health seminar on cessation. And the result is that person becomes actively interested in quitting smoking. The third stage is evaluation, where the smoker weighs the advantages and disadvantages of quitting. He sees that advantages are better health, saving money, and disadvantages are withdrawal symptoms and habit disruption. So the result is the person evaluates whether quitting smoking is worthwhile for them or not. Fourth stage is trial. The person tries quitting smoking for a short experimental period. For example, the person stops smoking for 1 week and uses nicotine gum to manage cravings. The result is that a person experiments with the new behavior in a low commitment way. The fifth stage is adoption. The person fully commits to the new healthy behavior. For example, the individual permanently quits smoking and actively avoids smoking environments and triggers. The result is that healthy behavior becomes permanent and successful adoption is achieved. So this is the comparison of the two models. That health consciousness model has 5 steps and sorry, 7 steps, and ITA model has 5 steps. Both models describe gradual behavior change, but a health consciousness model emphasizes on the psychology, and the ITA model focuses on the adoption steps. So this was all about today's presentation. This was the part one of the topic of health education. And the second part means the remaining portion will be presented tomorrow. Now we come to the practice of MCQs. Question number 1 is, a community health worker distributes pamphlets explaining the symptoms and prevention of dengue fever to residents in a village. Which function of health communication is primarily being performed? Option A, information. Option B, motivation. C, persuasion. D, organization. E, counseling.
A.
Yes, A, information. Question number 2, a government enforces a law banning smoking in public places and imposing fines on violators. Which approach to health education does this represent? Option A, service approach. B, health education approach. C, regulatory approach. D, primary healthcare approach. And E, social marketing approach.
C.
C.
Yes, C, regulatory
C.
approach. Question number 3 is, a community sanitation program encourages residents to actively participate in cleaning their surroundings and maintaining hygiene. Which approach to health education is applied? Option A, service approach. B, regulatory approach. C, health education approach. D, social marketing approach. And E, primary healthcare approach.
C.
It's actually E, primary healthcare approach, where community is participating. People are participating in the cleaning activities. Fourth one is during a health campaign, people first start hearing messages like HIV or AIDS is preventable and unsafe practices increases the risk. Which stage of health education does this represent? Option A, stage of motivation. B, stage of education. C, stage of publicity. D, stage of sensitization. And E, stage of attitude change.
C.
D.
D is the right answer, stage of sensitization, because they have just start hearing about the disease and the messages about it. Question number 5. In a town, most residents have stopped smoking and it is socially discouraged. Even new residents adopt this behavior. Which stage of health education is this? Option A, motivation. B, publicity. C, community transformation. D, education. And E, sensitization.
C.
C.
Yes, C is the right answer. Community has transformed. Question number 6. A health educator carefully chooses simple language and ensures the audience clearly understands the health message. Which quality of the sender is demonstrated? Option A, confidence. B, credibility. C, concise message. D, clear communication. And E, concept clarity.
D.
D.
Yes, D is the right answer. Question number 7. A health campaign message states 30% of the children in this community are undernourished. Which component of a health education message is represented? Option A, claim. B, evaluation. C, warrant. D, data. And E, feedback.
D.
Yes, B is the right answer. Data is shown. Question number 8. A health educator sends a message through radio about malaria prevention and later asks listeners for their response. In the Shannon-Weaver communication model, the listeners who interpret the message represent the option A, sender, B, channel, C, media, D, receiver, and E, feedback.
E.
E.
D is the right answer. Listener is the receiver of the message. Ninth question is a person first hears that smoking causes cancer, becomes curious and searches for more information about quitting. According to the IETA model, which stage is this? Option A, awareness. B, interest. C, evaluation. D, trial. E, adoption.
B.
Yes, B is the right answer. He is taking interest now. Question number 10. A group of 8 to 10 people sit together with the facilitator to discuss health problems and share their experiences face to face. Which health education model is this? Method is this? Option A, panel discussion. B, symposium. C, workshop. D, conference. And E, group discussion.
A.
No, E is the right answer, group discussion. A would be selected if we have mentioned that there are some experienced people discussing about a problem. This is the answer key. This is the YouTube channel of Institute of Public Health Lahore, where this presentation will be uploaded later on. Thank you so much.
Thank you very much, Dr. Amna, for a very nice presentation. However, there are very few things that should also be included. For example, the Delphi technique and the importance of focus group discussions when the experts are available, and the modified Delphi technique so that the consensus can be reached for health education. Moreover, the emphasis of the small group knowledge delivery and learning, that should also be a part of health education. Similarly, the theories of health promotion, like we have rainbow model and other important techniques, that should also be included in health education. Please include
Right,
these in your slide, and please share it again. So thank you very much everyone for your listening.
right, ma'am. Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am.